Good morning, good afternoon, good evening, everybody. Thank you for joining with us today to our webinar. We just launched our webinar, and I can see attendees are joining in. So we'll give a slow start in the beginning so that everybody could catch up. A warm welcome to everybody and greetings from Asia Pacific Malaria Elimination Network APMEN Vector Control Working Group. For those of you who are not familiar with our network, we're very delighted to welcome all of you to our events. So APMEN, it's a network of 22 country partners all across the Asia Pacific and partner institutions that include universities, research organizations, the NGOs, so civil society organizations and funders and international technical partners as well, all across the world, all of which are committed to eliminate malaria in the Asia Pacific by 2030. APMEN delivers its mission through 3 different working groups, namely Vector Control Working Group, Surveillance and Response Working Group, and VIVEX Working Group. So one of the key functions, how APMEN support countries in terms of reaching the elimination goals, is to facilitate information exchange, learning to improve program effectiveness, peer learning, as well as harnessing our collective insight and wisdoms to address most of the implementation challenge and bottlenecks that all countries experience. The TechTalks are unique platforms we created to do technical deep dive and also to promote sharing and learning across the region. So I believe this is a 7 installations of our TechTalks, and we have gained a quite large turnout from our regional country partners and partner institutions as well. So let me give you a little bit of mechanics and how we will run this webinar. So all of your videos and audios for participants have unfortunately been disabled to be able to run the show quite smoothly. But we have Zoom chats and Q&A functions. And I would like to encourage to use chat box as well in order to say hello to everybody and to welcome. And whenever there is questions you'd like to raise to our presenters and panelists, please use the Q&A tab. If you insert your question in chat, we will not be able to track. So if you use Q&A, it's easier for us to track and raise and prompt the questions to our speakers. So there will be 3 back-to-back uninterrupted presentations. Back slide, please. Presentations. So after that, there will be a panel discussion Q&A, and we'll have a quick poll afterwards. So the topics we have chosen today is about one of the important preventative tools in our vector control toolbox, the insecticide treated nets. Since 2014, over 2 billion nets has been distributed globally. And since their introductions, the nets is found to be effective in averting malaria cases and deaths and providing community effects and making them one of the most cost-effective preventative measures ever created in our malaria history. With the proven impacts, and donors and multilateral organizations have poured in investments, and that led to global scale-up, making them public goods. With what accompanied with this success is the emerging threats. And of course, many of you have already aware that there are biological threats such as insecticide resistance, which has given a great amount of attention by researchers and innovators that led to creation of the new generations of insecticides, and the new types of bed nets are already underway. But what we believe that we still need to address is non-biological challenges, and we'll unpack what do we mean by non-biological challenges and how does it equally as important as biological ones. So in very recent Global Fund result report, Global Fund has distributed 188 million mosquito nets, and years after years we have seen the access to nets are getting higher and are getting closer to our goal of universal coverage, and therefore reaching to our goals to close the vector control gaps. So these are the very precious global goods, and as a group of nations and technical organizations, we need to dive into how do we make sure these nets stay effective as they want them to be and remain an important and useful and impactful tool in our toolbox that will help us get there to the elimination goal. So we will answer the questions, how do we maintain the effectiveness of these impactful public goods in a region near elimination, as Asia Pacific, how can these tools can still be part of the solution? And also in the country NNC perspective, how do countries need to adapt their airline campaigns, distribution campaign to overcome these threats? And in the global stakeholder perspective, what needs to be done? What need to be done differently in terms of strategy, policy, and other implementation? What adaptations are required? To answer these questions, we have a privilege to welcome our panel members who will give us unique insights. And now I would like to introduce our panel members. So our first panel member is Dr. Kim Moon Moon. She's joining us with us today, so we're very privileged to have her here. Who Senior Technical Director for University Research Committee, our URC Defeat Malaria project in Myanmar. Dr. Kim Moon Moon brings quite a diverse experience in malaria programming. She's one of the pioneers in Myanmar who created the Myanmar Malaria Elimination Program. She used to work with the National Malaria Control Program, and she herself is a manager of the Myanmar NMCP and a mentor for a lot of malariologists and professionals working in Myanmar. We are very grateful to have her perspective, which will give from the implementation point of view, as well as the National Malaria Control Program point of view in addressing these challenges. We are also lucky to have Dr. Hannah Koenke, who is a Technical Director for Tropical Health from the USA. Unfortunately, Dr. Hannah cannot be with us in person due to time zone differences. I'm sure she is now in good sleep in America, but she will be giving a pre-recorded presentation. And for the questions that we want to raise to her, we will do it post-webinar offline Q&A functions for her. We're also lucky to have Angus Spears, who is the Director of Innovation to Impact I2I based in Liverpool. And we're very lucky to welcome back Angus to our APMEN conversations, Angus recently gave a presentation on the private sectors and the innovation point of view during our APMEN annual conference as well. Next slide, please. So my name is Tin. I'm a program coordinator for APMEN Vector Control Working Group. I also work as Malaria Consortium technical specialist and regional representative. And we have one special guest from Malaria Consortium. We're very we warmly welcome our technical advisor, Dr. Prudence Hamade, who's based in London, Malaria Consortium headquarters. Prudence will be giving a closing commentary, a wrap up for everybody right at the end of the webinar. A key takeaway, which Prudence is really good at delivering, a key crisp points that what we learn from this webinar. All right, so this is please follow us on the APMEN activity if you want to get updates on what we are up to. These are the websites, there's the Twitter handles, and also like and follow us on Facebook and Instagram as well. So without further ado, can I just ask if Dr. Kim Moon Moon is online? Ma, are you there? Dr. Kim Moon Moon, are you able to unmute yourself? Dr. Kim Moon Moon is currently in Yangon, who are currently experiencing with internet connectivity. Ma, are you there?
Yes, now I'm.
Yes, very happy. Very happy to hear you, Ma. So thank you very much for joining us, and we're very looking forward to learning from your presentation. So over to you, Ma.
Yeah, thank you. So please share my screen from your side. Thank you.
Yes, we will share your slides. Yeah.
Yes, thank you. Yes, good afternoon. Good evening to organizers of the APMEN Vector Control Working Group from APMEN and panelists and the audience from the different countries and the regions. Today, I'll present non-biological threats to insecticide-treated nets effectiveness based on the experiences of USAID PMI-funded defeat malaria in Myanmar. Next slide, please. Defeat Malaria is working malaria control and elimination in continuum approach in 36 townships of 4 states and regions, that is Rakhine, Karen, Sagaing, and Tenindai, as shown in the map, covering 1.6 million population. That is approximately 30% of total population of those areas from 2017 up to now. Thank you. Next slide, please. National Malaria Control Program Myanmar is following the GTS and GMS strategies, and the key interventions are in line with WHO Southeast Asia region. Defeat Malaria follows the policy guidelines of WHO, PMI, and NMCP, and carried out in interventions according to the National Malaria Strategic Plan of Myanmar, aiming to achieve the maintained universal coverage of at-risk populations with proven effective control. Next slide, please. Operationalization of LLIN distribution. Most of the Mekong countries are reaching nearly the last mile of malaria elimination. Mass distribution of LLIN has been replaced by the targeted and continuous distribution strategy. Next slide, please. Our targets and channels of LLIN distribution are periodic mass distribution in every 3 years was carried out for endemic villages, most in the endemic ethnic minorities and border areas, and villages with indigenous cases active foci. The pictures represent the mass distribution in the hotspots villages of different communities in Rakhine State. Next slide, please. Targets and channels for LLIN distribution. And it is the LLIN distribution to the forest-related workers in the elephant camps in Rakhine State and forest work sites in Karen State. Next slide, please. Pictures represent the distribution of LLINs to the mobile and migrant populations at different work sites in Tenindai region through worksite supervisors and village malaria volunteers. Next slide, please. The next group is pregnant mothers at their first antenatal care visit to health facilities by midwife, collaboration with township health department and rural health centers. That is push model, where distribution is driven by the attendance of a specific service. Next slide, please. Another group that must take care even in very low transmission area is malaria positive patients in their residence and work site through village malaria worker or surveillance and response team. And another channel is ad hoc distribution in the events of a disaster, malaria outbreak by township defeat malaria teams. Next slide, please. The slide shows the backpack health worker team provides LLIN to the current ethnic population in hard-to-reach areas. Next slide. LLIN distribution is incorporated with COVID-19 activities, house-to-house LLIN distribution by township defeat malaria team in collaboration with PHS in the context of COVID-19. Next slide, please. Transportation of LLIN is also backbone of LLIN distribution. These are some examples of transportation of LLINs to the hard-to-reach areas in various means in townships of the Tenindai region and Rakhine State. Next slide. Defeat malaria distributed nearly 175,000 of LLIN, that is 63% of target, within 3 quarters of fiscal year 2021 through different channels as shown in the table. Next slide, please. LLIN monitoring has been carried out in sample villages after 6 months of mass distribution. This slide shows the pictures of LLIN monitoring at Rakhine, Karen, Tenindai region, and Sagai, where health facilitator was using mobile tablet with open data gate application. Next slide, please. This slide shows the LLI monitoring by using load quality assurance method, data comparing 2020 and 2021 as of July, which shows percentage of villages with acceptable coverage level increased from 77 to 96% and percentage of villages with acceptable utilization rate improved from 77 to 97%. Next slide, please. This slide shows the couple health education program with LLI distribution in different areas with different settings in Karen, Rakhine, and Tanindai region. Up to now, I have presented the mechanisms of LLI distribution in terms of approaches, coverage, utilization, coupled with health education sessions carried out in the project sites of defeat malaria. However, gaps, issues, and challenges are still existing in the area of vector control like other parts of the country and the region. Next slide, please. In fiscal year 2021, defeat malaria has conducted formative assessment and qualitative assessment on comprehensive understanding of community on socio-behavioral needs relating to malaria control and elimination in 6 townships of Rakhine, Karen, and Tanindai region. The findings pointed out that non-biological threats to effectiveness of our distributed ITNs, and some of the facts indicated that ITN alone is not adequate preventive measures for certain population sectors. Next slide, please. Both formative study and qualitative assessment showed more than 80% of villages slept under LLINs, but the consistent usage was apparently unlikely. Is varied by age, sex, season, and population type. For instance, women, children, and elderly use more than men and mobile migrant populations, and more in rainy season and less in summer. It suggests that human-centered design and behavioral economy is required. Next slide, please. During segmental analysis, significance in level of malaria knowledge and LLIN use between 2 genders was found out. Women were found to be more articulated in explaining proper ways of LLIN usage, washing, and maintaining than that of men. Since men had high risk with their working situations, low risk perception of having good immunity, and inconsistent use of LLIN with various reasons, such as just to improve social behavior change activities at field level. The strategy should employ community participatory learning action approaches. Next slide, please. In sector-wise analysis continue, non-biological threats of ITN effectiveness is more obviously seen in mobile and migrant populations and forest workers. Male had more liability to sleep without bed nets, giving various excuses, being overdrunk, too tired to have attention for bed net, giving priority to elders and children, and working outside of home, etc. As seen in the figure 2, there are many challenges to reach mobile and migrant populations due to their mobility, legal status of their engagement in illegal trade and work. Repellence as personal protection was recognized reasonably, but more among forest goers than general population. Next slide, please. I'd like to show some slides supporting above findings relating to mobile and migrant populations, forest goers, and vector control. The circle shows both vectors, Anopheles minimus and Anopheles dirus, endo and outdoor biters are taken part in the start of monsoon, May to June. In that period, some mobile and migrant populations are still in the forest. Some are coming back to the villages with fever. Next slide, please. The slide shows increased monthly number of malaria tested and positive cases in Palot Township, Tanindai region from April to June, which is coincide with the period of increasing both vectors density shown in previous slide. Next slide, please. The factors and evidence mentioned in the previous 3 slides are threatened The existing achievement of the areas that are in the last mile of malaria elimination pointed out that anti-and distribution alone is not adequate for mobile and migrant populations and forest goers. Tools for prevention of outdoor biting anopheles is in our areas is crucially important. Appropriate supplies along with social and behavioral change for these target group is essential. Next slide, please. Qualitative assessment team recommended that the forest grower package is good example of context-specific social and behavioral change intervention which enhance effective line usage. There is still need to increase supports and supplies. Next slide, please. Alternative ways to access prevention measures for those people, social marketing of quality line, insecticide treated hemlock nets, especially for current state, and encouraged using repellent and wearing long sleeve t-shirts for the forest goers and replenishment with voucher scheme. Forest goers schemes should be in place. Next slide, please. According to the findings, defeat malaria try to design health education section involved by men. The picture shows the demonstration of line usage by inviting men at Orma village in Kyakto township of Rakhine State. Next slide, please. Participatory village mapping for malaria is practicing in some villages with community support groups, revealing houses of forest goers, farmers, and fishermen, outbound migrants, for distribution of extra LLIN for forest goers. Mosquito breeding sources like wells, ponds, creeks, etc. near the villages for awareness and practice of larva source management as necessary. Seasonal migrant websites to prevent reintroduction of malaria by raising awareness of immigrants may carry the parasites with them. Next slide, please. As recommended by the qualitative assessment team, the training of SPC and PLA was carried out up to field level, and this picture showed problem tree analysis on not using alliance conducted by community support group members of a village in the Tangok Township of Rakhine State, facilitated by the health facilitator of township team. Next slide. This is my last slides, and in conclusion, progress towards malaria elimination will be accelerated through the targeted effective deployment of proven vector control interventions in addition to anti-ants at-risk population, and utilization of new interventions, proven new interventions tailored to the needs of the specific high-risk communities, and along with the human-centered design, social behavior change approaches are needed. Thank you for your kind attention.
Thank you very much, Dr. Kim Moon, for your brilliant presentation. It's really highlights the gaps in terms of the coverage, access, utilizations, which I'm sure our next speaker, Dr. Hannah, will talk in more details. And what really stands out in terms of the solutions that URC applied is I really like the idea of post-distribution APMEN doing monitoring evaluations and applying of the digital solutions in doing more efficiently, and that gives us a program manager to have a sense on, you know, what's changed, what changed with access, what changed with the utilization, and so on. That the gaps could be monitored very closely, and I think that's absolutely brilliant. And the facts that the application of the human-centered designs and community participatory and the leveraging on the gender, applying, involving men in delivering messages are really, really important in terms of this key population. So I would like to move to the next speaker, which is Dr. Hannah Koenke, who unfortunately cannot be with us live. But many of you in the vector control community would know Dr. Hannah, who has been kind of a go-to person when it comes to the ITNs. She had led quite a significant work. Mainly her work has contributed to global policy on the ITN distribution, the strategies, and her research focuses on the quantification of ITN distribution using multiple channels, issues related to ITN use, including durability, which is a key issue that we'll be covering today, net care, user preferences, behavior change, and so on. Most significantly, she has led as a director of PMI Vector Works from 2014 and 2019, where she developed several tools and guidance materials for ITN monitoring and user uptake promotion as well. So let's watch what she has to deliver to us in our recorded presentation.
Hi, everybody. I'm Dr. Hannah Koenke, the Technical Director at Tropical Health. Thanks very much to the organizers for having me. I'll be talking today about ITN distribution and some challenges and opportunities that we have. So I was asked to talk about achieving universal coverage in ITN campaigns. What is enough in terms of what we're trying to achieve in terms of targets and how we get there and quantification. How much tailoring is feasible and what kind of channels can we use to reach hard to reach populations and meeting the needs of hard to reach populations. So let's dive in. So first off, I just want to talk a little bit about some of the challenges we have in quantifying and reaching the targets that we have for access to ITNs. So this graph is from a recent paper by Amelia Pertozzi-Villa in Nature Communications this year. We've got population access to ITNs, which is the proportion of the population that could use a net, assuming that one net protects two people. So they've got something in their household, a net in their household that they could use. And when we compare that to nets per capita, so total number of nets in this population divided by the population, it seems that at the levels of 0.5 nets per capita, which is one net for two people, ITN access can really only hit around 60 to 70, 75% here. And if we want to get to the point beyond that, we lose a lot of efficiency and we end up needing to distribute in order to reach, for example, 90% population access, which could result in about 80% population use of ITNs. We would need about one net per person to reach that. So I think Cambodia had a strategy like this for a while at some point, but we may need a lot more nets than we have, or that we've been giving out in order to reach the targets that we've set for ourselves within a given population. So just to highlight that a little bit here, certainly can make things difficult. So we also know that nets wear out, they develop holes, they're thrown away, new nets are acquired or preferred nets are acquired, and ITN access tends to fall over time if no other distributions occur. We also know that periodic mass campaigns result in a kind of rise and fall of coverage over time, even in countries where nets are being given to pregnant women and infants on a regular basis, so routine basis. Those channels alone really can't sustain universal coverage at high levels all the time. And partly this is because we are seeing lower retention times, median lifespans of nets than the 3-year expectation. So does that mean mass campaigns need to happen more frequently? That's going to be super expensive. Can we make nets more durable? Maybe, probably a little bit. Can we affect people's behaviors so that they hold on to those nets for longer, take care of them a little bit better so that they don't develop holes as quickly, and they continue to manage to provide protection against vectors? That would be probably the most cost-effective solution if we could get people to do that. So there's a lot of challenges with that, as we know, and work done under PMI Vector Works and continued under PMI Vector Link really shows that there's a lot of variation that's driven by environment and context around the globe. And we need to look at net durability in the context of those attitudes, practices, behaviors, and environmental context. In DRC, we've got very low median lifespans for nets. It's a very difficult environment. The same product might perform quite well in Nigeria, on the other hand. So it's difficult to say that a product, specific product might be less durable without going through a lot of very different data from a lot of different places. So hopefully that will be coming forward in the next few years. We also want to look at the gaps and be mindful of our gaps that we have with ITNs. There's inherent limits to ITNs as an intervention, as I'm sure everybody's aware. Outdoor exposure, and when people are indoors but not sleeping, you can't use a net at all times that you're actually exposed to mosquitoes. So that's the feasibility gap, and we've got new tools on the horizon to help address some of those places where and times where people are exposed. So there's kind of a natural ceiling here in terms of the universal use of ITNs and what that provides us for malaria control. Then we have the access gap, which is really driven by funding, quantification, and durability gaps. And then the use gap comes in here. You know, once people have a net to use, their choice to use it or not can be driven quite frequently by the level of risk that they perceive to themselves. And that can also vary over time and space and age and sociocultural factors. So just to keep in mind all of the gaps that we have with ITN so that we can manage expectations appropriately. We've got a lot of options for monitoring ITN access and use. Surveys are the standard one, but usually mass campaigns do a pretty good job of reaching those high rates. So we don't tend to conduct a lot of surveys right after campaigns. When we want to monitor use, we have some rapid options, including mobile phone surveys, targeted rapid surveys in key populations, and the periodic large household surveys and the knowledge, attitude, and practice surveys can be really helpful in interpreting trends over time. And I hope we'll hear a little bit more from the other speakers on those as well. And just we really always want to interpret the results about net use in the context of whether people have a net to use or not, because otherwise we're not sure if they don't have one. And the issue is access, or if they have one and they're making a choice not to use it or to use something else. Preferences is a big issue. I know I've done some work on this in Sub-Saharan Africa, and I know there's been a lot of work in Asia Pacific. There's a lot more options on the market for nets for consumers in the Asia Pacific region, and they're more affordable than many options in Sub-Saharan Africa. So what we see overall in most places is that given the overall lack of other options in Sub-Saharan Africa for nets, people do tend to just use campaign nets they're given. They don't have a lot of other places to get them from, although untreated nets are making inroads, I would say, in a lot of places on the coast and in urban areas. Obviously, the situation is different in Asia Pacific. We've got a lot of preferences for smaller mesh, a lot of preferences for much bigger nets, taller nets. Not that people in Sub-Saharan Africa don't have those preferences, they do. It's just that they're less able to act on those. And so we don't see preferential use of untreated nets, for example, among a lot of the population. So I think keeping those preferences in mind and making sure we understand to what degree those preferences are really affecting the use of ITNs is really important. And there's a lot of continued research, I think, on those fronts, and hopefully we'll hear a little bit more. So when we talk about net use, just making sure we're understanding the context that people are operating in, recognizing the limitations of that intervention. We can't expect people to sleep under a net, when they're getting up early to go fetch water. Those are things that they have to do. Empathizing with people's priorities and thinking about the gaps so we can manage expectations. And then just a little bit about sustaining ITN access. I think sustainability of ITN distribution is a big topic. At some point, somebody has to pay for these nets. The manufacturer won't give them away for free. So if it's a sustainable channel, does that mean international donors are just going to foot the bill for the next X number of years until we have a vaccine and things are really great and somehow we've eliminated malaria and we don't need nets anymore? Or we switch to another vector control option that's even better. That'd be also fantastic. Is the national government's going to start paying for those nets, or are we going to put the burden on households and individuals to buy their ITNs at retail prices? There's a couple of things I'm worried about with that, but that's always the best way for people to get exactly what they want if they have the ability to pay for that. So as we know that nets were out, we have these cycles and rises and falls in coverage. It would be nice if we had consistently high access, and then we could have consistently high use, and that might help us in our malaria control programs. A number of continuous distribution activities are at scale. These are sort of beyond just ANC and EPI distribution of nets to pregnant women and infants. These are continuous distributions through primary schools for the most part, or community-based distributions in Zanzibar and Madagascar, where there's a coupon system where community members can request a net and then receive it at the time that they need. We have had good success in Tanzania with the school program. We have really high ITN access after 7 years with no mass campaign in the school areas, the school net areas, and that's been really encouraging. A lot of resources are available at cdtoolkit.org. And there's just country examples, step-by-step guides to community and school distribution, some additional resources on other types of channels. And then the Alliance for Malaria Prevention.com website has everything that you could possibly want on mass campaigns, including links to the continuous distribution website as well. So just some final thoughts maybe on the retail market, because I know that will come up later, and hopefully we can provoke a little bit of discussion there. It would be great to have a variety of ITNs in the retail markets that were affordable, that meet consumer preferences, so that people could get the net they want that's insecticide treated and contribute, to reducing malaria in that way. There's a few barriers, including complicated national registration processes for ITNs that have inhibited manufacturers from trying to seek registration for their products, leading to less competition and less availability of ITNs in different countries. Lower volumes for retail mean higher prices. Those are passed on to the consumer, and that tends to leave out the lower wealth quintiles. And the manufacturers and suppliers are generally haven't observed in the past a good return on investment, and most of them have shut down their retail efforts because of the costs of marketing, the costs of employing sales representatives are just too high to justify the profits that they were making from those limited sales. Subsidy programs have done a lot of work in the early years of ITNs and still today in some places. I would say these might have limited success. There's still costs to running those programs, but they can help to provide those nets to certain segments of the population. So interested to hear more about those efforts from the other speakers. And I would just maybe leave you with this thought that untreated nets in this context are not the enemy. They do complement national ITN programs. If a household has a few ITNs and then some untreated nets, and then everybody is sleeping under a net, that's fantastic. Even if one or more of those nets is untreated, people are still protected. They don't contribute to insecticide resistance, and people are able to kind of meet their preferences with those untreated nets because of the price points and the options that are available. So with that, I'll just leave you with my favorite net photo: where there's a will, there's a way. And thank you very much for having me.
Thank you very much, Hannah, for giving us the recorded presentation. A lot of interesting point raised there. So just a couple of highlights, and I'm sure there are colleagues from the National Malaria Control Programs in the audience. So I just, if there's something that I like to take away, that the point is that when you plan for the national ITN distribution, mass cycle usually comes with a 3-year cycle, and there isn't more evidence coming up. The ITNs are not as durable as we expected them to be, and there are a lot of factors in play. And Hannah's presentations really highlight those kind of the factors that are in influence. So how do we make sure that can be adapted, considering in that the knowledge on the durability, and really highlight the importance of the monitoring and evaluation as well. well, and an application of tools to make it more rapid information to know whether or not the net's been distributed. Because this is really critically important, because most of the programs and the donors tend to report more output figures like X numbers of nets being distributed, but not really analyzing the gaps will put the effectiveness of ITN in question. So it's critically important that we do some kind of monitoring. And the methodology for the net durability monitoring is still evolving, but there are some good methodology out there. I'm sure Angus will walk us through some of those that have been applied in some of those countries, and I hope that we could come up with some standardized metrics in doing the monitoring and evaluation. So without further ado, let me invite to our next speaker, Angus, who is the Director of Innovation to Impact, and who's currently based in the UK. And Angus has been working in the NGOs and UNICEF sector and Population Service International as well, focusing on malaria, child survival department, and variety of various portfolio. Currently, Angus is leading Innovation to Impact I2I program, which is set to streamline access to new vector control tools, and working very closely with WHO as well in introduction of those pre-qualification, and also engaging with the vector control stakeholders, and really putting innovation into people's hands. So he has a very wide knowledge of how to work with the pre-qualification teams, how to make more accessible for the new tools as well. So we're very lucky to have Angus on our webinar. So over to you, Angus, and good luck. Thanks.
Thank you very much. Can you see my screen okay and hear me?
Yes, we can see and hear you okay.
So thank you for that introduction. I'm not sure I'm worthy of all of that, but very nice. And I'm very honored to be back, and very happy to be talking about this. And I do owe Hannah a debt of thanks for sharing her slides with me beforehand, because there might have been quite a bit of overlap otherwise. I'm going to talk about obviously the non-biological threats to insecticide treatment, and we've heard already today from a very much a country perspective, and Hannah's obviously talked about a lot of the work that she has been involved in over the past few years. And so I'm going to take a bit of a broader look at some of these issues, and obviously it's a very detailed subject that would warrant a much longer presentation, but I'll try and focus in on some key issues just to get the conversation moving. So obviously ITN quality has been in the news quite a lot in the past few months and years, and I mean this is just a selection of articles, but there have been various concerns, qualms, issues raised about various products over the past few years, and really this hasn't done much to help with the confidence in nets, and really has raised a lot of questions. And one of the things I've been thinking about a lot recently is, do we actually have the information to really understand what is going on here, or what the problem is? Really the conclusion comes to the fact that we need to think differently about ITN quality. I do have a strong feeling that the standards by which we monitor or judge ITNs right now are maybe not fit for purpose in this new era of dual AI nets. And knowing what we know from a lot of, for example, the durability monitoring that's gone on, and just the experience of working with long-lasting insecticide-treated nets over the past decade or so. But I also think it's important to, when we're talking about quality, to really think about, well, what are we talking about here? Is this an issue with the net quality, or is it an issue with the net specifications? And really, so this is really about a production versus design type issue. I mean, so is there evidence of poor quality nets being produced by a manufacturer, or do we need to look at the standards of these nets, the specifications, and ask, well, are they actually working in the context that we need them to? So really just sort of trying to unpick some of those aspects, I think, is going to be key to really understanding what the issues around durability and effectiveness of nets are going to be longer term. Key to this, and I think Hannah mentioned it really as well, I mean, are we measuring the right metrics? And do we have the tools to measure those metrics? And are there other things that we measure and value right now actually the metrics that are best represent the quality or the fit for purpose for the nets in situ. And I think as well, one of the things that we need to be thinking about, what is the supportive environment that we can foster to give the nets the best chance to perform when they're being used, and are we doing that consistently? And I'll touch on all of these in the coming slides. Basically, though, my feeling is that I feel that there is a fundamental lack of trust in LLI and quality right now, with all these issues raised, and I'm not sure we have, as a community, all the information to really try and assuage some of those concerns. And I think it's something that we need to be focusing on to try and develop those systems to promote quality and promote trust and understanding in what these products are and what they aren't. So just to, I think this is the only slide that overlaps with Hannah's, but again, coming back to this fantastic publication by Emilia Bertozzi-Villa, which really did shine a light on LLM retention. And I just wanted to show this just to show that there is a huge variation in retention times of ITNs in different countries. And further analysis by Albert Killian earlier this year showed that even within countries, you get variation as well in terms of the retention time and the life of nets. And so, you know, we can talk about net quality in terms of the design of the net or the quality of the manufacturing process, but really there must be other factors at play here as well if we see these very country-specific differences in net retention. So what are those issues and how can we understand them more effectively? So these are some slides that I've managed to get from NIRI, the Non-Woven Innovation Research Institute, who did a whole lot of research about 7 or 8 years ago now into the causes of net failure, the mechanical causes of net failure. And here you can see some of the most common: seam failure, hole enlargement, tears, abrasion, and snags. And what they really wanted to do was say, well, what are the common causes of failure of nets in a physical perspective, and are we actually measuring those nets in a way that will actually give us some sort of predictive value for the net's ability to resist that sort of damage? They also recognize that there are a bunch of threats that nets are not designed to withstand, and these are fairly well documented, but really the misuse, cutting, flames, and also rodents. No net's going to really be able to withstand this. It's not what they're designed for, and so you can't expect a net to be resistant to this kind of use. But when they actually did look at the damage from on the nets, and this is a bit of a history lesson for those who were involved in this back then, but they looked at the damage from over 500 nets, which is 40,000 damaged areas on a net, to look at the most common or just basically catalogue the causes of failure of the nets. And as you can see here, the majority of damage was mechanical, 81%. And when it's mechanical damage like this, it means it's preventable damage from the nets. And so it's something that we can probably do something about. And just to point out as well that this damage was fairly consistent in the countries that they looked at, and as you can see, ranging from about mid 60% up to high 80% mechanical damage. So the preventable damage largely being the most common type of damage that was recorded. So thinking about, you know, what does this mean? How can we use this to try and better evaluate these products for their resistance to this type of damage? The NIRI have actually come up with a suite of tests that you can see there, 5 tests listed: abrasion resistance, snag strength, bursting strength, hole enlargement, and seam strength. Right now, it's only bursting strength that's looked at in WHO evaluation. So really trying to get a sense of, you know, how resistant different nets are to these different types of damage. And because different nets work differently, they propose this resistance to damage, or RD score, which amalgamates all of these metrics into one score, which, you know, could purport to be a metric by which we could measure the net's resistance to these common types of mechanical damage. This was actually tested by Albert Killian in a paper that he released earlier this year, looking at, is the RD score predictive of net life? And largely it was. And if you look at this next slide, this RD score, you can see two lines there, the blue one being nets with an RD score of over 50, and the dashed red line with the RD score of under 50. And what he found was that the nets with an RD score of over 50 had approximately a 7 month later or 7 month greater median lifespan than those under 50. And so I'm not, the reason I'm talking about this is really that I think we need to be looking at the data that we have been collecting, looking at the science, looking at the causes of the damage and causes of failure of nets, and trying to think through different ways that we can improve the way that we are specifying these products, that we are evaluating these products, and thinking through the data that can help us make more informed decisions at country level about these products. And I'm not saying RD score is the exact way forward or not, but I am saying, it's something worth investigating. I will say that in that paper, Killian did also say that we need to collect more data on this to make the indicator more robust and make the science more robust. But I think the ethos of actually trying to think through what we know about nets, what we know about these products, and how we might be able to measure them more effectively is something that I want to get across, because I think that's how you make better informed decisions at a country level. In terms of data generation as well around these products, we've heard from the two previous speakers about country level data being generated. I think that's a very worthy and necessary activity. But one of the things that I really think we need to be aware of and we need to be thinking through is making sure that we have methods that are validated to actually describe these products. So, for example, we don't have a validated method for bioassaying dual active ingredient nets. And there are some being worked on, some being developed, and I2I's played a role in trying to consolidate some of these. But it's difficult to measure a product and its effectiveness if you can't actually measure the key indicators accurately and reliably. And so really, thinking about how we do that and what we actually need to know, I think is an area that we as a community need to be aware of, and again, to provide countries with the information that they need to make these informed decisions. I think a good example of this, there was an excellent paper released earlier this month on the wash resistance index and wash testing in general, and some thoughts in there about how to really, think about doing that in a valid and helpful way. I also think there needs to be a huge amount of focus on interpretation of data. I don't think we're really clear on what data is or isn't telling us at a country level, and I don't think that we should be reacting to one net performing poorly in one country and assuming that's a poor product. As we've seen earlier, that there's a huge variation in net retention and net life in countries, and so there are so many other extrinsic factors that need to be considered into this. And what we've seen and what the risk is from just taking data from one product in one country is just trying to extrapolate that across the globe and for that product more generally. And I think we need to have a better, more data, a better story about those products to actually be able to make clear assumptions about it. And I get the impression at the moment a lot of QA is carried out in the academic press, and I really think that the QA of products is a more sort of a data-driven, process-driven activity that needs to focus on the continuous improvement of nets and not just tell us when something is failing, although that is important data to play into a QA process down the line, but it is not the be all and end all. Lastly, on the data, I think we need to be better about sharing data transparently. There's data generated throughout a product's life cycle, from its manufacturer to pre-shipment testing, post-shipment testing, durability monitoring, all sorts of data that is being collected, and it just doesn't talk to each other. And this is because there's multiple stakeholders involved, and it's very difficult to sort of say, pick out a point in a net's life cycle and link it into data at other parts of that life cycle. And I really think that the transparent data sharing element of this would really help consumers, malaria programs in particular, understand the products that they're implementing better and be able to make more informed decisions around that. Just an example of this, I mean, this is from a report on the WHO's RDT testing program, which published annually the performance of RDTs that were on the market, and this was before RDTs became part of the pre-qualification process. But I think this is a really nice example of product improvement over the rounds of testing as data became available and people were able to compare the products against each other. You can see here that over the 8 rounds of testing that they did, that the quality of the products judged here by the product fulfilling WHO procurement criteria increased over that line of testing. And there was a huge shift in this market, which was largely unregulated after the first round of testing, to really sort of shape it up and to call a spade a spade. And I'd say as well, this isn't only limited to public health products. I'm a big fan of the NFL, the National Football League in the US, and they also do product testing, this time on helmets and to prevent concussions. And so making data available, making this quality information available, helps people understand what the product is and how it's performing and what they can expect from this product. And whether it's football helmets or whether it's RDTs or nets, I think there's a lot to be gained from having a more coherent and transparent data sharing process. Just quickly as well, thinking about conditions to allow nets to perform, and I think there's a lot we can do around supportive environment to help this. I mean, first of all, I think giving developers room to innovate is a key part of this. If we want more durable products, then we can't just keep saying, well, produce to a specification that, I think it's questionable as to whether that is promoting more durable products. Generally, I think manufacturers will produce to the specifications that they're asked to. And so how can we use those specifications to encourage innovation in the field for more durable products and using metrics that are different from the ones that we have right now? I think that also comes with a flip side of being, and Hannah mentioned this, that someone's got to pay for them. So, how can the procurers themselves actually look at recognizing this and recognizing metrics to improve that quality, and then encourage it through being able to pay for them. I think behavior change is a key role, and I think the first presentation really outlined how powerful that can be, really fantastically. And I don't have much more to add on that, frankly, other than that in that Killian paper, he did note that in areas of high exposure to net care messaging, there was a significant increase in net life, which I think is a really important finding. And I think we need to really look at knowing how nets fail, looking at the mechanical damage, looking at preventable mechanical damage of nets. I mean, that really does say to me that there's a huge amount to be invested in BCC or SBC around net care knowledge, and also the practice of how to do that as well. And without that, I think we're asking nets to perform in suboptimal conditions. And I think as well, there's been a lot of discussion recently, particularly from the AMP group, around net storage and transportation. And AMP actually came up with some really useful guidance on storage of nets in suitable temperatures. So making sure that the supply chain is actually coherent with the specifications of nets, so we're not storing them in conditions that are suboptimal. So that when they do get distributed, they are as optimal as they can be after that process. I think is another aspect that is being looked at, and certainly when having nets delivered in countries, I think is something that needs to be considered as well, particularly if they're going to be sitting around for a few weeks. Finally, just drawing on the old adage that it takes a village to raise a child. Well, it takes a village to improve the quality of ITNs, and I think we need to recognise that the issue of quality and durability in nets is the result of a multi-stakeholder continuum. there are many different players in this, from the manufacturers to the WHO in terms of its evaluation and policy, from procurers, shippers, the national programs and their partners who implement these products. And all of these different partners have different roles and responsibilities within this chain. And I think one of the things that we need to be doing more is looking at how we can link these partners together. How can we sort of be clear about what roles and responsibilities are? So there aren't fingers just pointed at, for example, a manufacturer or a procurer or a country or whatever it may be, but recognizing that QA and quality improvement is really at the focus of that QA for these products, and not just trying to point out where products have failed, but thinking about, well, how can we make these products better? How can we understand these products more to make sure that that nets are doing what they are meant to be, what their policy recommendations says it will be, lasting for 3 years, and both physically and chemically. So thinking through that, the incentivization, the rewards for innovation, this focus on continuous improvement, and the better and the more available data around these nets, I think it's going to really help this this effort move forward. But we need to have a coherent vision of what quality involves and who is involved in that. So thank you. I will finish there, and
thank you very much, Angus, for a very excellent presentation, and you walk us through very onto the good practical point. So we are closing to the end, so let's just get on to the panel discussion and Q&A. So if I could ask our brilliant presenters to turn on the videos and also turn on the mic in order to respond to some of the questions. And I see Dr. Kim Won has been actively responding some of the questions pointed to her. So thank you very much for that. So for those of you, you can also read her responses in the Q&A tab. Just want to pick one. I see they've been upvoting, so I will first start with our participants' questions. And this one comes from our good colleagues from Cambodia, CNM, Dr. Siv. It's really about, for a country manager perspective, the point he raised is that there have been different pre-qualified airlines in the market, which has different quality. However, from the country's experience, manager's perspective is that there's no choice for the country to say which nets is preferred in the country because of that pool procurement by the Global Fund or other funders policy. Is there a different way that we should be doing in terms of letting country have more say in selecting that? And Angus pointed out that we need to have information available so that the country managers can make more informed decisions. What needs to be done differently in that regard? Maybe Angus, if you could go first.
Sorry, I was typing an answer, so I was. Can you repeat the question?
It was a bit of a country manager perspective that there are a lot of PQ nets in the market, but not many say they have in terms of choosing which is the preferred nets for them for the country context and other settings.
Yeah, I mean, it's a complicated one, and it comes up very often and many times over the years in terms of being able to choose nets. And I think, I don't speak for the procurers, but I think they're generally looking at the large long-term agreement orders, and so choice becomes quite limited. Although the procurers all say that if you have data that suggests a type of net, whatever it may be more effective in a country, then they would consider that. But I haven't seen too many practical examples of that. So I think it's a challenging one. It's a difficult one, and if there are strong data from a country that suggests use of a certain type of net is likely to be higher, then I'm sure procurers would consider it. But I think it's obviously a difficult one when you're talking about the economies of scale from doing bulk orders. So it's yeah, I mean, I'd like to have if there's a procurer online, maybe they can answer this sort of question. But yeah, I mean, I do think it's one, that kind of issue. I'm sorry if that'd be more helpful on that.
No, thanks, Angus. I mean, it has been a constant and issue that come up in our admin exchanges with our country program managers and field implementers as well, because we talk a lot about preferences and accessibility of the nets. We do a lot of surveys, and they have community have feedback on the color, the materials, and that they want to see. But there is a point noted in our previous annual conference is that there's a disconnect. Procurers and manufacturers know there is a community feedback loop, but they couldn't change any specification they are producing because it will then affect the cost and everything. So we just want to acknowledge that this is and resolve challenges that we're still having, because aside for the net quality, I think that really important is community accessibility and the preferences or the type of nets that they received. Maybe that one more question to Dr. Kinmon Makimomon is that as we noted in the your presentation as well as Hannah's presentations and Angus' presentation, so there is a possibility that we whilst we can't make more durable different type of nets, why don't we preserve the current ones? And then as noted in the presentations from Angus, is the mechanical problem seems to be the important issues to solve. So we talk about net use in our BCC, SBCC campaign. Would that include an element of net care, like asking communities, how do you detect holes in our nets? And is there a way to man their nets so that they become more durable in the way of involving community more in preserving these nets?
Yes. Thank you, Dr. Dr. Tim. Yeah. In our health education program, and also when we distributed Alliance, we give the pamphlets for how to take care the nets, how they have to do, how they have to wash, and how they have to preserve. They have to preserve the durability of the Alliance. But when we conduct the LLI monitoring, we have found out the holes, and like Angus has presented, we found the holes, and then within the housewives they keep that like that. So we asked them to sue, and then in our project, there are MNMA, especially the midwives and the sisters, they go when they go the LLI monitoring, they showed how to sew, something like that. So this is the repair of the mechanical damage for this LLI. And but a different thing is that our housewives, they used to wash frequently. So it is the way we have to tell them it is not too much to use, and then to avoid detergents and to use soap bar, something like that. We have also during the distribution, also during monitoring, LLI monitoring, we give them the education and the messages. Thank you.
Thank you very much, Dr. Kimomon. I think it's an important element that in the long way forward, then we should really emphasize on the component of the net care as part of the community education program. Maybe one more question to Dr. Kimomon. You highlighted in the earlier presentations that country nearing elimination. I think this question is relevant to most of our audience in this webinar, is that countries are adapting more targeted distribution rather than blanketed distribution, and then we determine the risk of the specific sector of the population and direct more LLI. I think this sounds very great to the donor's perspective because it is more cost effective, more targeted. But in that sense, will that be also trade-off in a sense, how good, how robust the data we are using to determine risk? Can that sort of left out certain populations, for instance, mobile migrant populations, which has been highlighted quite as a key population in the vector control gap? So if that risk matrices that we're using are not covering these population, will that give a challenge for getting universal coverage? And how should we improve on using data more accurately in that sense?
Thank you. actually, when we are nearly reaching to the elimination, our data become, the number of cases become less and less. And then villages, most of the villages, they are like in our country, Ma'ao, Ramri, this type of, some are most of the villages, they have free from malaria. So how can we determine who is risk, who are at risk? So actually, we should have a receptivity analysis for the existing situation. For example, in our Rakhine State, you may remember the Paukto, that is the Payunga Island, something called the Pumpkin Island. So in that area, some villages, they have no malaria cases for 3 years, more than 3 years, but they got suddenly, last December, we got an epidemic, small outbreaks there for the 10 to 20 people there affected, something like that. So how can we determine, we decide which is risky, who is not risk? So that is so we should have a receptivity analysis first. However, there is no cases. If there is a receptivity, if one vulnerability is there, for example, some people, due to the displacement or due to the disaster or any complex emergency, they enter that village. If the people vulnerability, they have parasites in their blood, they can transmit the parasite, and they can have outbreaks there. So if where the risk is there, or so that kind of villages or areas should have a good surveillance system. Good surveillance mean not the data that no cases, there is no cases, so they won't go do the MERTT test, but our ecological surveillance is important. That is the ecological surveillance, and what that mean is that people entry, immigration, outbound, they are going out or going in. So the people population movement is important. That's one. Two is the receptivity, where the breeding source there, or whether there is a history of vector or entomological investigation there. So something like that. So these information are needed for long term. Thank you.
Thanks, Mark Kimamon. A very important point, not just using case numbers as an determinant factor for risk, but more broadly using this receptivity and vulnerability as indicators to determine whether this area should have an aligned be part of the aligned distribution target. Maybe one final question to the panelists. I think we are getting close to that. It's actually 2 points. The first point is, Hannah mentioned about the traditional nets not being the enemy of the ITN campaign, complementary, and there's one interesting comments coming in, whether that would negate the whole purpose of using ITN's distribution and expansion of coverage. And at the same time, I think it would be important to discuss, the future sustainability of these nets, because majority are still heavily donor dependent, and no countries have immediate access should the donors' funding withdrawn through the retail market. So what is an opportunities there that the countries can start thinking in terms of planning for different scenarios should that ITN's global supplies cannot be sustained in near future? So Angus or Mata Kimamon, whoever like to take that.
So that's the lady first, yeah. But I have the opposite way. That is what I have experienced. Before LLIN, I was team leader of Rakhine State. At the time, we have no LLINs, and APMEN malaria is there in Sitwe. So I have to use the ordinary bed net very carefully. and how to set up the ordinary bed net is very important. So at that time, my child is only 5 years, and then I have to protect him also from the mosquito bite. So this is very important. Hanging and the setting up the how to set up ordinary bed or LLIN is very important for the housewives to know. And then my son, he has he was taught how to set up since then, and now after he has the children and he set up his net, so quite possibly. So this is one option. If we don't have donors, we have to teach the people how they have to set up properly their bed nets, what they have. So with available resources, they have to do. So this is the one point. And another point is that social marketing of the LLIN with franchising, the cost is very minimum or maybe acceptable for the people. So, for example, 4,000 to 5,000 jets our people can afford for this LLIN if they can have franchising. So, very early period of Global Fund, PSI has franchising with this nets, Papa net, something like that. So such kind of innovation or such kind of replacement from the companies. So we should invite the market. The market people, they may know how to how to sell their products, so they can have a marketing more than us. They may know, and then they can do it. So I would like to invite the marketing people to sell the LLIN, very quality LLIN, something like that. Thank you.
Thanks, Ma. Angus, would you like to add on something?
No, I think that's all incredibly relevant, and you know, really the answer has to be around the private markets. And you know, I agree with Hannah. I don't think untreated nets are the enemy. I wouldn't say that you're going to get many donors who want to procure them just because of the recommendations from WHO, but a net is better than nothing. And certainly the private markets can be and have been distributing these products for a number of years. But you know, are they targeted at the right groups? Are they at the right price point? That kind of thing. And you know, so I think, you know, a look at that, an investment in that sort of side of things would be very helpful. And I know various programs have been trialed over the years, largely with a lot of donor funding to put in a subsidy. But I think we're coming to a price point now with nets on the market that you know, can we think about, you know, full cost recovery for these nets, because you know, we're not dealing with $5 or $6 nets anymore, especially if they're untreated. So, and you know, I think, you know, there's a lot of data coming out of Southeast Asia that shows that there is a demand and there is a market for these products. My question would be, you know, can we ensure that they, you know, even if they are untreated or even if they are not WHO pre-qualified, you know, what is the quality control that we can, or the quality that we can put on them from the regulatory perspective in these countries to ensure that, you know, even if they are available on the market, they are still going to be quality products.
Thanks. Excellent remarks, Angus. Thank you very much. So we're getting close to the end of our webinar. Before we close, may I just invite our final panelist who is listening in, and Dr. Prudence Samarade to deliver as a closing takeaway wrap-up kind of summarization. So Prudence, we'll appreciate if you could through Tarble 3-5 minutes max. Thanks.
Okay, thank you very much, everybody. Thanks to the APMEN Secretariat for this very useful webinar, and thanks very much to the presenters for their very interesting and thought-provoking presentations. I'd like to first say how very valuable the function of APMEN is in providing these tech talks and really challenging our thinking around various approaches to malaria and malaria elimination. We know that there's a big focus on insecticide resistance and how to combat that resistance, but these non-biological threats are equally as important as insecticide resistance. We know that 2 billion mosquito nets are being distributed, but then we need to make sure that they're effective as well as efficacious. So we need to know that the insecticide that's in them works, but we also need to know all the other aspects of their use is focused on as well. So we need to have proper strategies and policies and adaptations needed to address the non-biological threats. Dr. Kinmunmon provided us with some very nice pictures of how URC is addressing the challenges in the various states that they're working in. Some of those challenges include the difficulty of the supply of nets to the very remote populations that are at risk in Myanmar. And I think that that supply situation, and as Angus mentioned, the proper storage and distribution of the nets is one of the big problems that we encounter when we're thinking of people using the nets. So, and especially when there are disasters or malaria outbreaks, how we find those outbreaks and manage to get nets to those populations is really important. So we also know that there are two approaches to distribution of nets. There's the mass distribution of the nets, and Dr. Koenke showed us that if we distribute the nets according to a 0.5 nets per capita, that only covers about 65 to 70% of the population. We also need to know how people sleep. For example, if we only have one net per 2 people, does that mean that children and older children and adolescents who don't sleep with their parents or with anybody else actually have access to a net? And indeed, Cambodia tried to distribute 1 net per person, and I witnessed some of that distribution. And in a very small hut, 6 people had 6 nets, and there was no way that 6 nets could be hung in that particular space. So again, that's a big problem. We know that routine and continuous distribution systems can oversupply some people and undersupply others. And it was very interesting to hear about the Tanzania school distribution program, which made the mass distribution of nets unnecessary, and that should be explored more, because school children very often influence the behavior of their parents as well, as we've found in some of our projects around dengue. So I think that we also need to look at those different means of distributing nets. We also need to take on board the fact that the durability of nets is very different in different contexts, both within countries and between countries. But both Hannah and Angus showed us some data on how that varies across countries. And I think people don't take that into account, because I think manufacturers and distributors of nets really take a very approach that one size fits all situation, and don't really take that into account. It also was shown by all the presentations how very important SPC or behavior change is in relation to nets. And actually, when we do these health education situations, we need to take account of what people can actually do. So if they're in the forest, for example, is a conventional net useful, or is even a hammock nest useful if we don't have anywhere to hang it? As Dr. Kinmunmon pointed out, actually hanging the net and how you hang the net and the proper way of doing it in the context of your household is very important. And there have been hundreds of net preference surveys done in the Asia Pacific region. All have shown that people don't like the nets that WHO procures. They don't like the texture, they don't like the big holes, they don't like the fact that they're not long enough or big enough to cover their families. How we approach that, whether we need to go to the private sector and do more social marketing or making nets very available to buy. People like in all the surveys that Malaria Consortium and others have done to look at how nets are used in post-distribution surveys or in malaria indicator surveys, we find that nets coverage is, LLIN coverage is very, very low. And the use of conventional nets is very, very high. And I agree with Hannah that we shouldn't dismiss the use of conventional nets. And perhaps we need to think innovatively around the use of conventional nets, whether we could go back to dipping them with long-lasting insecticides. Again, telling people to mend their nets when they get holes. Do they have the materials that they can mend the nets with? Can you sew those polyester, those nets that are very stiff and very plasticky? Is it possible to mend them? So telling people to mend nets when it's not possible to do it is something that we shouldn't be doing. So actually consulting the community a bit more about what are the difficulties of keeping and retaining their nets and making sure that they are mended, not washed too frequently, etc., is very important. So thank you very much, everybody, for this very, very useful and thought-provoking set of presentations. I think we need to go over them again and think about them more closely and how they will affect the policy and practice of WHO, and particularly looking at the effectiveness of nets, not just their efficacy, is very, very important.
Thanks, Prudence. Thanks for the very excellent remarks. And I hope that give us some takeaways, at least from our audience. So before we close, maybe if I could ask everybody to respond to the poll that is now live, it will really help to improve our webinars and delivering the right and meaningful content to all of our colleagues in the Asia Pacific. And just so you know, so all of the content, presentations, recorded webinar will be hosted on our website, Online Resources Exchange Network for Entomology, OREEN, which is also put in the chat. You may be able to find out the materials being uploaded in a 1 or 2 days time. So just give a little bit of time to recollect everything. So please respond to the poll. It really helps us to understand how we can improve ourselves to make sure we deliver our contents rightly. So again, thanks so much for all of our brilliant speakers and panelists, Dr. Kim Mon, Angus, Prudence. Thank you for your time and giving us this really interesting discussion, and hope that we will continue to carry these issues forward to within our APMEN Vector Control Working Group and across with our APLOMAR colleagues, and as well as with our global and regional colleagues as well. And hopefully we could come up with some solutions. And my sincere thanks to Dr. Leo Barak, who's listening in the audience as well, my colleague Wulan, who's behind the computers and technical support, and our great colleague from Singapore APMEN Secretary, Dr. Paul, for the tremendous support. Thank you very much for being here today. And I hope to see all of you again, and hope to stay safe. Thanks, everybody. Bye-bye.